Today gives a new meaning to the phrase new blood. PRP is being used in several procedures to do everything from regenerating your skin to regrowing your hair, and it can even rekindle the romance in your relationship. Wow. We're going to talk a little bit more in depth about that a little bit later, so if you have a little kid in the room, then, you know, the Barney video in the other room. Here to tell us what PRP is, welcome back Drshelenalaljiaesthetics with Dr. Shel Wellness and Aesthetic Center. Also joining us are her patients, Al Alamia and Angela Schwarzbach. Good morning. PRP, the first time I heard about it was surgeons who were using it for like knee replacements and stuff like that so that they could get faster recovery times.
Yes. Yes, so we have been using it in many different areas, just like you mentioned. And just like we talked about in the Hot Topics, it's all about what can we do to use our own stem cells and platelet-rich plasma to regenerate as much as we can.
And
so
that's
it's
what
all
PRP
about
stands for, is platelet-rich plasma.
Platelet-rich plasma. So essentially what we're doing here, as you can see on the video, is we draw the patient's blood, then we take the tube, and it's a special centrifuge, and you see the kit right there. You take it, and you actually put it in the centrifuge, and then you draw out the patient's own PRP, which has 10 or more collagen-derived growth factors.
Wow.
So it's your own growth factors, and if you look on the screen, you'll actually see as putting those growth factors into the skin with what we call is a micro-needling device. And it's something that just creates these microchannels, so the PRP goes into the skin and regenerates collagen by itself, just like it would in the knees or other areas.
All right, so PRP hair restoration, and Al, this is what you did.
Yes.
Okay, so you saw a difference, like when?
From when I had it done?
Yeah.
Oh, about 4 months.
Wow.
3 to 4 months.
Yeah.
I noticed that I didn't really notice how bad of loss I had until my kids and the lady that sits behind me at work.
They will tell you.
They're brutally honest with you. And that's when Dr. Shel talked to me about it, and 4 months later I started to see results.
Yeah, we're looking at the kind of results that you can get right there. And Dr. Shel, here's the deal. When you go in, the first thing you do is you want to make sure you know the reason why there's the hair loss. So you don't just say, okay, let's just start this process. You find the reason first so you can also address maybe some other issues.
Correct. So 65 million men and women in this country have hair loss and thinning hair. So why is that happening? And it's all about the root cause. Could it be your thyroid is undercorrected, which millions of people's are? Could it be nutritional deficiency? So we test for micronutrient deficiencies. Could it be hormonal imbalance? So we test for that. Could it be inflammation? So we also test for candida overgrowth, yeast overgrowth in the stomach, or inflammation caused by food sensitivities. So we look at all the root causes, but at the same time, we're all, let me get results now.
Right.
So you kind of want to stop the progression of the hair loss. So we use the right supplements. So we use a specially formulated supplement that I formulated myself for hair regrowth.
And let me talk about the importance of that, because you have a whole line of supplements.
Yes.
We buy a lot of stuff over the counter, and we don't know really quite what's in it. But as a doctor overseeing it, you know what's in your supplements.
Correct. They're all medical grade supplements, so they don't have fillers, and they have things that are going to absorb into your system without the inflammation. The right shampoos have to be used because we want to stop the conversion of testosterone to DHT on the scalp. So the right shampoos have to be used, and there is a great laser device, which is a portable home device called iGrow that we suggest to our patients, which stimulates the hair follicles. And these are all things that we do simultaneously while we're doing the PRP.
Yeah, 3 treatments, 1 month apart for the best results.
3 treatments, 1 month apart.
Basically like less than 20 minutes.
Yes, and quite comfortable. What would you say?
Absolutely quite comfortable. And being a guy, I'm scared of needles. But the results and the amount of time that you're there with her is, for the amount of time you're there and the results, it's phenomenal.
Yeah.
All right. Angela, you had the PRP micro-needling, and so you touched on that little video that we saw right there. But what was happening with your skin that you wanted to see something change?
Well, the texture, there was the texture issues and also fine lines. So, and I saw immediately from the first treatment, the skin improved, and people were commenting on it, and I went with the 3 or 4 series to...
Yeah, and sun damage also can help with hyperpigmentation, which is hard to correct.
Exactly. For any skin type, sun damage is very hard. So pigment, fine lines, like Angela said, wrinkles, you know, any kind of texture issues. It's just going to give you glowy skin. And again, you're doing it in a very, very natural way. This is another patient of ours that has had skin tightening. So you almost see a full transformation.
Right.
And that's what Angela was interested, right, Angela?
Yeah, well, once you get one thing done and you see results, you're like, what else can you do, doctor? And so you did do a number of other things from the inside out. And as you've always said this, Dr. Shel, you know, really invigorating yourself from the inside out. Because if the inside's not right, the outside won't be right.
Yes, so her energy.
Right. Whenever I just wasn't feeling right. I wasn't feeling normal. I was just dragging, a little brain fog, not a lot of energy. I wasn't sleeping well.
Yeah.
So that translated to not having energy, being irritable, your relationships, weight gain, everything. And my doctor I was going to at the time was just saying, well, take this, use that.
Yeah, the doctor I was
like a
one side,
you're
just getting older.
Yeah.
No,
okay, but I want you to stop that.
Your levels are normal. Yes. I don't want to be normal. I want to be optimal. Yes. And I saw Dr. Shel speak at a women's group, and I said, I want everything you just said.
Yeah. Okay, let's address that. Your levels are normal for your age.
Exactly. Right.
What does that mean? Because if we're all suffering together, I don't want to suffer with you.
Exactly. That's right. We want to be optimized. So, you know, especially with thyroid and hormones. So I am a strong believer in bioidentical hormones, which are hormones that are biologically identical to what your body's produce. So again, go
otherwise
natural.
your body might not recognize it.
Exactly. You don't have the receptor sites. So especially with thyroid, most of the people, I bet most of the viewers have had their thyroid checked and they've been told it's normal.
I was in the range.
Exactly.
I was within the range.
But the normal range is this wide.
Yeah.
And what you need to be is this wide because that's optimal for you.
And your symptoms tell you as a doctor that you are not in normal range.
So you might have fatigue, low energy, sleeplessness, so, you know, irritability, depression, constipation, hair loss, skin issues, all of that. So if you're having those, you need to think and be your own advocate. And that's, Angela, I respect my patients so much because they have been their own advocates. Right. And they come in and they say, I want to be better.
Yeah, and for so, you went through the same thing we went through.
Absolutely, I did. After my son was born, complete transformation. I could not recognize myself. And that's where I left traditional medicine and started functional medicine to start helping patients like myself.
Yeah, because you're an OBGYN.
I'm an OB-GYN, and so it's been 11 years of a great journey.
Okay, you touched on something you said affected our relationships. A lot of times a hormone slide is also a slide in our libido.
Absolutely.
Okay, now if you have young kids in the room, hopefully they're enjoying Barney right now. Because there's a thing called, have you heard of this, the O shot? Oh, you haven't heard? Okay, tell us what the O shot is.
So the O shot, you know, the whole field of feminine rejuvenation and just focusing on sexual health for both men and women is very important, like we talked about. And so there are several laser procedures that are now very safe, and you know, we have 4 different such lasers to address vaginal dryness, vaginal atrophy, painful intercourse, as well as just laxity and stress incontinence. And we can do that non-surgically now. And then to put a little cherry on the top, there's the O shot.
No pun intended.
No pun intended. There is the O shot, which stands for, O stands for, you say it.
You know what we're talking about, don't you?
Okay.
Yeah.
So O stands for that. And essentially we place the PRP in a very medical way into the anterior vaginal wall as well as the clitoral head. And so essentially you have more regeneration of tissue and sensation and nerve endings in that area. So your satisfaction is much heightened, as well as your libido then is heightened, because for women it's a vicious cycle. When they don't have satisfaction, their libido does go down, along with, of course, looking at the testosterone pellets and, you know, make sure that their testosterone is optimized.
Basically, I think what you just said, and don't email me on this, okay? Do not call, don't tweet, don't email, no Facebook.
Because we warned you.
Said you can make the hoo-ha go yee-haw. That's what you said.
That's it. Now, we can't leave the men out, Deborah.
No, we can't leave the men out.
No, there is a P shot for the men as well.
Oh.
But we're not talking about that today, are we? But it's the same concept of the PRP going elsewhere. For the
what's good for the goose is good for the gander.
That's it. That's it. Okay. So that's beyond this segment's discussion.
Okay. But I just want to end with the fact that it's called Dr. Shel Wellness Center.
Yes.
And it seems like that's the way medicine used to be done a long time ago, and then we kind of got off track, and it was medicine was a prescription or a surgery.
Right.
We've gotten back to working with the body. So explain to folks what wellness means for you.
So wellness means, for me, I look at an 8-step approach. I'm going to look at my patient's sex hormones, their stress level, which is their adrenal hormones. I'm going to look at their nutritional deficiency, so balance their nutrients with the right supplements. Not patients come into me with $300 worth of supplements, and I'm like, well, you don't need this.
Or none of it's effective.
Exactly. So really looking at that. Looking at the gut. We talked about inflammation, and inflammation leads to things like chronic diseases, heart disease, and cancer. Parkinson's, Alzheimer's, that's all based on inflammation is what we're discovering now. So the gut, the nutrients, sleep, hydration, healthy eating, the adrenals, which is stress management, so yoga and meditation, very important. And most of all, get yourself optimized, whether it's with your thyroid, your hormones. And once you feel awesome, you're energized, revitalized, then look at everything else and get everything else looking and feeling
It's like that should be your physical. That should be the physical that you go get.
It should be. And, you know, gone are the days I used to get only 10 minutes with my patients when I was practicing traditional OB-GYN. Now my initial visits are 45 minutes to an hour because I've got to know everything about you as a person, not just a chart or a number.
I'm telling you, it's the best investment you can make is in yourself. Because when you do that, then you're like ready, set, go for the second half of your life.
That's right.
Thank you very much. Dr. Shel has a special offer for Great Day Houston viewers. The first 50 callers will receive $200 off any PRP or aesthetic package. To jump on this offer, call 281-313-7435, 281-313-7435, or you can also just dial 281-313-SHEL. You can also download Dr. Shel's free ebook and join the list to learn how you can look and feel your best with Dr. Shel Wellness. Log on to drshel.com. That's Dr. Shel with only one L.com.